Good evening, dear friends. Welcome to yet another episode of BMC Global Live AlHilal Health World, Nothing But Lifestyle. In each episode of this talk show, we bring before you an expert doctor from AlHilal Hospital to discuss your various health issues. Today we are going to discuss the subject mechanical back pain, and we are delighted to have with us Dr. Chethan Kashivasi from AlHilal Hospital, Hammathtown. He is from the Department of Orthopedics and his area of expertise include hip and knee replacement and spine and fracture surgeries. So, doctor, welcome to the show and thank you for joining us today. So, doctor, you are from the Department of Orthopedics. What are the services you offer at AlHilal Hospital, especially in your department?
Now we have actually main hospital is in Moharak and we have seven medical centers. All of them are open 24/7 and we have almost like 15 orthopedic surgeons working in AlHilal Hospital, specialized in various fields in orthopedics like spines, replacements, trauma and pediatric orthopedics. And we have a very good operation theatre facility in Moharak branch where we can do most of the orthopedic surgeries, and 24/7 one of the consultant will be available in Moharak also, and in Hammathtown I will be available for consultation from morning 9 to 1 and evening 5 to 9 every day other than Fridays. So we have very good CT scan and MRI machines where we can do excellent MRIs and CTs, and also we have very good radiologists who can do musculoskeletal ultrasounds, which can diagnose many of the sports injuries, especially common in and around Bahrain. So I think people should take advantage of this.
Okay, doctor, now coming back to our subject, what is mechanical back pain?
Mechanical back pain is something like it's any back pain which is associated with the bones in the spine, ligaments, the disc and other structures around the spine, which is actually which happens following a direct injury or a acute injury or a cumulative injury.
Now you mentioned about acute injury and cumulative injury. What's the difference between those?
Acute injury is anything like say ranging from a simple twist in the back up to a road traffic accident. Any injury which happens is an acute injury. A cumulative injury is something like repeated injuries which happens because of like you sit in office for long hours in improper position, that will hurt your back. You do like weightlifters, they will lift the weights repeatedly, sports injuries and any like work related stress on the spine. They cause repeated injuries to the back. We call it cumulative injuries.
So doctor, now we know that there is a mechanical back pain. So is there a non-mechanical back pain also?
Actually, we should be more worried about the non-mechanical back pains. Non-mechanical back pains are the pain in the back which are not directly related to the injuries. It happens because of some other conditions, like it may be infection, it can be malignancies, it can be ranging from like congenital anomalies, rheumatisms, even age-related arthrosis. It can be like anything, and usually these non-mechanical pains are more serious conditions, and most of them they may need some medical attention, even surgeries, and they need more medical attention than the mechanical back pain, which are more common, but non-mechanical back pains are less common.
So how common is back pain these days?
To say like 90% of the population, they have experienced some amount of back pain in their lifetime. At least once they would have faced the experienced back pain. So out of which majority of them are mechanical back pains, especially so in the younger age groups, like age group less than 45 years, it will be most of the time mechanical back pains. As the age increases more than 45 years, the non-mechanical pain tend to occur more frequently
So should we consider this a serious condition, doctor?
Mechanical back pain as such, when the topic what you are actually discussing about is not generally a serious condition. Most of the patients with the mechanical back pain, they get better either with treatment, the pain disappears, or without treatment also. Usually most of the times it disappears, but out of which at least like 2 to 5% of the patients, they can progress into serious conditions like disc prolapse, which can compress on the nerves. They can have instabilities which may warrant some surgical intervention also. So yes, maybe 1 or 2% of the cases they go up 2 to 5% of the patients they can go for serious condition, not, but the majority of them are not serious.
What are the tests to be done, doctor, to diagnose back pain, because the back pain is a symptom of many other diseases also?
Yeah, that's what I am saying. If it's a mechanical back pain, then there is no point in doing any, like there is no say what you say, like requirement for any imaging studies, especially like MRI, X-rays and other things are not really required for the, it has a very limited role in mechanical back pain. But there are any, if there are any like red flag signs which shows us that it can be a non-mechanical pain which can be arising out of the some infection, it can be some malignancies, it can be some congenital anomaly. So they may need, that will warrant some investigations including MRI, blood tests and other like even X-rays, CT scans, MRIs, blood tests. So that with that, to rule out any non-mechanical causes, they may need some investigations.
What are the treatment options, doctor, you go for mechanical back pain?
In mechanical back pain, the mainstay of treatment in the initial like acute stage when they come with pain following an injury or like acute pain, it will be like analgesics for the pain, muscle relaxations, muscle relaxants, and then the physiotherapy and rest. This will be the mainstay of treatment in the initial phase. Like once they get out of that initial phase of pain, then it will be actually the lifestyle modification, postural changes, using proper gears during their, like say for a weightlifter, he has to use proper support for the spine when they are lifting the weights. Although in the workplace there will be lot of gears which they need to use proper gears when they are doing their work. So all these things will go a long way in like preventing any further damage to the spine following the initial back pain.
So is surgery a treatment option, and some people have the conception that after surgery people will lose their mobility and all. What is your opinion?
Surgical management as such in mechanical back pain is rarely required. I would say like only 2% of the patients they will need surgery once they land up in like say nerve compression because of disc prolapse or maybe instabilities. And even in these cases, the surgeries for mechanical back pain like disc prolapse and instability results are really excellent. The people don't have to be really worrying about the results, such as most of 99% of the patients after surgery they go back to their like previous work. They don't have to like worry about surgery will happen. Yes, complications are part of any surgery or any treatment. So 1% of the patients can have some minor complication, but usually it will not be like anything like losing mobility or anything. Maybe the recovery may takes longer time, but then usually they go back to their regular work without any problems.
So doctor, what are the risk factors for back pain? Can you explain for us?
The main risk factor for mechanical back pain or in generally common back pain what we are talking about is sedentary lifestyle. You sit in office for long hours in wrong positions and in improper chairs, you sit for long hours. That is the main reason why we get back pain, and most of the patients come with back pain are with sedentary lifestyle. And the other risk factors which I can say is like obesity, overweight, which is one of the main reasons people have back pain, and even the treatment as such in obese patients are not very like promising. So they need to just lose weight. And others like other risk factors are like smoking, alcohol consumptions, lack of like leisure time exercises, just daily some activities like walking and other things, they can actually prevent lot of problems. So leisure time exercises are also lack of leisure time exercise. These are all the risk factors which I can see.
Can we prevent back pain?
Let's be practical. Back pain is universal. I wouldn't say, it wouldn't be practical to say that I will prevent back pain by doing this, I will prevent back pain by doing that. No, back pain is universal, everybody would get that. But yes, if you take care of your back properly, you can prevent lot of complications arising out of these simple back pains which can actually progress into serious conditions, so like disc prolapses or maybe nerve compressions, maybe like instabilities, all these things can be prevented by taking proper care of your back. Simple measures like lifestyle changes, some simple lifestyle changes which can be advised like individual, which can be, the advice can be tailor made for each patient, like how what is their work actually, according to that we can give some tailor made advices for the lifestyle changes, postural changes, or even say like weight reduction, that will go a long way in their lifestyle. And second, other thing is like quitting the smoking, alcohol consumption, all these are risk factors which we discussed about earlier. You just do that, then you will prevent the the complications of back pain. I wouldn't say you would not get the back pain if you do all these things, but yes, the complications you can prevent, and you can live with a very like happy life without going for any like surgical management or anything.
We can manage back pain and live a normal life.
Yes, with back pain is universal. I wouldn't like guarantee anyone like you will not get back pain, but yes, you can manage back pain, manage the complications of back pain and prevent them. Almost like most of the patients we can prevent complications.
So doctor, you explained about mechanical back pain and you said non-mechanical back pain is more serious. Can you explain about non-mechanical back pain in detail?
For today's topic it would be out of context, but then yes, they should be really worried about, people should be more worried about non-mechanical back pains, and the awareness about non-mechanical back pain should be there in everyone. So just because most of the back pains are mechanical, we cannot neglect. I would still suggest, if you have back pain which is not getting better with simple medicines or rest, you should consult a doctor. Maybe there is some non-mechanical causes, even nowadays, even in young patients, like even in like 35-40 years, we are seeing malignancies and so many things. Especially if you have some family history of malignancies, any pain which malignancies, you should consult a doctor. Maybe there is something wrong, you should just consult the doctor and take an opinion. And other things like if the pain is lasting not more than 4 weeks, any pain in the back which lasts for more than 4 weeks, I would say is not good. You should just consult a doctor, and the mechanical pain should not last more than 4 weeks. It can last, but then most of the times no, it should be something, either it is going in for some complications like disc prolapse or maybe nerve compression, or there may be a totally different cause. It was not the injury which has caused the pain, maybe there is something else, maybe the patient has some congenital anomaly which needs some attention, maybe there is some inflammatory arthritis like rheumatism, or maybe there is some because of the wear and tear, there may be some osteophytes which are pressing on the nerves, so they need lot of attention. It's not that every time you need surgery, but then if you can identify those problems early, maybe we can avoid a surgery in non-mechanical pain also. So we should be aware that there are not all back pains are that simple. Most of them are, yes, but not all of them. Out of maybe, if you say, if I see maybe 50 patients, out of which only one may be having non-mechanical pain, but then if we can pick up that one patient early, they can have a healthy life. Maybe they can prevent complications, we can prevent a surgery, so it goes a long way. So the people should be aware that if they have a back pain, they should just consult. It's always better. Don't neglect backache.
Okay. Now before we wrap up, what is your advice for our viewers?
Don't neglect any back pain, even if it is any simple back pain because of injury also, don't neglect, especially so if it is going beyond 3 to 4 days, or if it is not getting better with medicines, please consult doctors. So, and especially AlHilal, we are available 24 hours in all the centers, so take advantage and take advice.
Okay, thank you doctor, thank you for joining us and giving us so much information about mechanical back pain. Thank you once again. So friends, back pain is universal, but with proper lifestyle changes like weight management and exercise, we can manage our back pain. So take care of your health, be happy and be healthy always. Till we meet again next week, this is Jasila Mujib signing off. Good night.